you, doctor, for allowing me a few minutes of your time after my appointment. I have a proposal I'd like to make to you. As the name of your practice implies, you're a pain and wellness center, and I know how you've really wanted to improve the aspect of wellness that you offer your patients. As you know, I'm a registered nurse working towards becoming a nurse practitioner, and I've recently become certified in the complementary alternative medicine therapies, in part because of your suggestion. My proposal is this. I'd like to become a nurse counselor in your office and consult with patients following their appointment with you for up to 20-minute intervals. Now, this is within the scope of the nurse practice, registered nurse practice, and I've actually outlined with the rules and regulations, and I've highlighted where the aspects would relate to this. My vision is to work perhaps 1 to 2 days a week and not request a salary at all. What I would need would be a table with 2 chairs, and I would also need for your staff to schedule the first appointment to determine interest. I would schedule subsequent appointments myself, and I would also handle any remuneration on an individual basis, billing insurance when appropriate, and not requesting an out-of-pocket any greater than $25 per patient, so that it's affordable to anyone who's interested. Now, I've devised a checklist here that I'd like you to use when you're seeing the patient. You could write the diagnosis of the patient and check off any aspects of wellness or treatment that you would like me to focus on in my consultation. For example, if the patient is suffering from fibromyalgia, we could look at aspects, for example, of diet. If the patient is an IBS patient, the advantages of low-fat, high-fiber diet could be important. Supplementation could be important as well. For example, magnesium is helpful in easing muscle pain, and most patients don't know about this. Where exercise is concerned, if you would recommend aerobic exercise or stretching, sometimes the patient doesn't know where to start, and discussing this with the patient might help increase compliance and help them to determine an exercise program that would work for them. Also, I put on here emotional and spiritual support. One of the things I know you've long wanted to do is to have support groups, and I just see that this could have potential to grow into support groups, or perhaps seminars, perhaps exercise groups such as Tai Chi. The potential is really there to grow. To me, it's a win-win situation because I would definitely learn a lot from my patients and gain valuable experience, and you would show the commitment that you have to patient care and to their wellness. So, would it be possible to meet again and talk about this some more? And thanks again.